Good morning on this beautiful day and welcome. I'm Risa Davis, president of the Chicago chapter of the Links Incorporated, and it is my pleasure to welcome you to today's forum. Since 2015, our chapter has focused its programming on mental health, a serious public health issue that significantly impacts African Americans. Our program focus, Links to Hope, Closing the Mental Health Gap in the African American Community, supports our efforts to reduce stigma and raise mental health awareness. The silent stigma regarding mental health conditions in our community creates a substantial hurdle to diagnosis, treatment, and management. Mental health challenges, including stress, depression, anxiety, and substance abuse, have been exacerbated since the COVID-19 pandemic and subsequent shelter-in-place orders. Although mental health discussions are becoming more prevalent, the voices of prominent African American women, such as former First Lady Michelle Obama, have energized the conversation, further helping to reduce the associated stigma. This year's Links to Hope programming will continue to address the promotion of mental health and wellness in the African American community, focusing on education, access to resources, and strategies for coping. We are pleased that you have chosen to share this inaugural Links to Hope program, Black Women Coping with Stress, Anxiety, and Depression during COVID and beyond. Let's talk about it. We extend our deep appreciation to our program team, Health and Human Services, and International Trends and Services facets for leading this effort. Chapter members have worked tirelessly to ensure a meaningful and impactful program. Thank you, sisters. We also thank our distinguished panel of doctors for their participation and the sharing of their expertise on this important topic. We have a number of members of the Links Incorporated joining us today, and we thank you all for doing so. We appreciate our 14th National President, Gwendolyn B. Lee, and our Central Area Director, Monica Allen, for joining, as well as Links Sisters, Metropolitan Water Reclamation District Commissioner, Kim Dubuclet, and our chapter member, Illinois Lieutenant Governor Juliana Stratton. We also thank State Senator Maddie Hunter and any other elected officials present today, as well as any other national and area leaders of the Links, including our own Dr. Kimbra Bell-Ballark. We thank everyone present for joining what we know will be an enlightening and informative presentation. It is now my pleasure to introduce our moderator. Micah Materre is an Emmy-winning journalist and anchor of the WGN Evening News at 5 and 6 and the WGN News at 9 and 10. In this role, she has covered numerous historic events, including the election of Barack Obama to the presidency. Micah has produced and reported for the station's Chicago's Very Own segment and has served as host of the People to People Civic Affairs program. We are so fortunate to also have Micah as a member of our chapter and really appreciate her lending her time and talents to programs such as today's. We know we are in very good hands. Micah?
Thank you so much, Risa. Thank you to everyone. Thank you to our Link sisters. Thank you to sorors who are out there, our distinguished guests, and everyone who is joining us, because first of all, if you're joining us, then you, like all of us, need a little bit of information to deal with what's going on. First of all, it is my pleasure to be a part of today's events. It's a topic that's much needed to talk about, to have conversation about, which we don't always do. Women, you know that we keep a lot of stuff inside and we don't talk to everybody about this. But this is a way to get it out in the open, to talk about it. And as I'm talking, I want you to take your poll questions. I want you to get in there and find out what you need to know and what you'd like to ask of the guests and what you'd like to know a little bit more about. But I'll get to that in just a second. But I first want to talk about Black women coping with stress, anxiety, and depression during COVID and beyond. Because Lord knows we have dealt with this way before COVID, we will deal with it during COVID, and we will definitely deal with it after COVID. I applaud our Links chapter for taking mental health on as something that we have needed to talk about for so long. Mental health, as Risa said, is something that has been pushed under the rug, something that people say, oh, mental health, I'm not even going to talk about it. We are so afraid to go get help. But mental health, folks, is our number one thing that we need to get together. There are, you don't realize it, depression, you feel a little depressed, that's your mental health. You feel a little anxious, that's your mental health. You don't want to do something today, you're overwhelmed, that's mental health. The stigma of mental health is just blown up, especially in the African American community. What we need to realize is mental health should be our number one priority, especially for ladies. Ladies, when we break down, it's like a house of cards. Everyone breaks down. I know we're usually the major caregivers, but if we're not there to give care to our family members, to our friends, then who's there? Then everything breaks down. It's like a domino effect. So please, if you leave this webinar with nothing else, know that you are number one priority before anyone else. You need to be tended to. And once you're tended to and your mental health is intact, then you can move on and help others. Self-care is so important. And I think that's something that we need to leave here knowing about it. And also know that we think we can do it all. There's no such thing as doing it all and having it all. Society says women can do it all. Yes, you can do it all according to your norm. Don't try to build up to what society thinks. The average family should be this way. You should be doing that. Once you figure out that the norm is your norm, things will be a whole lot better. Trust me. When I first had kids, I thought I had to do this, I had to do that, I had to be there, Once you have a great support system, the children don't realize who's giving the care as long as there's someone there for them, and they come out all the better. My sister, brother, and I grew up with a mother who worked, who got her master's degree, who went to school, who did all these things while bringing us up. At the same time, we had breakfast on the table every morning, we had a lunch to take with us every morning, and we had a dinner because she knew what was important. And I don't know if self-care was that important back then, but you have to realize if you want to do certain things, you have to take care of yourself first, because without you, there's nothing. So mental health is important. And again, don't think mental health means always people who can't deal with things, or someone, a lot of our homeless people, their mental health, they have issues with mental health. And that's very sad because this country does not put enough effort in recognizing mental health. But again, they're at the most severe level of mental health, and all of us, mental health issues, I should say, and all of us have mental health that we have to deal with. We're all dealing with some sort of mental health issue. Understand that. So there's a severity, and there's small little bits and pieces that can grow into this huge issue of mental health issues. That was a little redundant, but you know what I mean. So don't think that you're immune from depression, anxiety, things like that, and not being able to deal with this, because we all are dealing with this. And COVID on top of it, it's like a firestorm, a volcano erupts. We know that African-American men and women and Latinos are disproportionately affected by this COVID issue. And we have got to keep ourselves healthy, mentally, physically, to try to battle this this issue of COVID. So it's like, I'm not gonna say icing on the cake, but it's like rocks on top of what we're already dealing with, because mental health is something that we all need to be aware of. So if you get nothing out of this webinar today, know that you need to take care of yourself. You need to recognize the signs and the symptoms. And we have a fabulous, astute panel to talk to you about this. So I want you to pay attention, take notes, and please ask the questions, because at the end of this, you're going to be able to get your questions in and talk to some of these experts, because they are in fact experts. Where else can you talk to people who are experts in their field when it comes to mental health, but in this panel? So hats off to our Link sisters who put this together to give us this opportunity to listen and to talk about this. So before we get started, I taught you a little about the poll questions that we have. We would like to gauge your comfort level about mental health and what you know. So what you're looking at right now on your screen are the poll questions. So take a look at these poll questions, okay? Take a few minutes, read through them, give them, I'm gonna give you guys about maybe 5-6 minutes to answer. I know you can do that because we wanna get started. And then put your questions in, and then we'll come back right after that, look at these poll questions, and then we'll get to our panel. Let's move forward. Let's talk a little bit about a letter that was sent to our former First Lady. I think you're familiar with her, Michelle Obama. This is called the Voices, well, let me just tell you this. The voices of prominent African-American women, like First Lady Michelle Obama, have ignited the conversation among African-American women regarding the impact of stress, anxiety, and depression, which is exacerbated, of course, by this pandemic. Now, a group of Chicago psychiatrists, 2 of whom you are on today's panel, penned an open letter to First Lady Michelle Obama, and we would like to share a portion of that letter with you. You're looking at it right now. Dear Mrs. Obama, as Black female psychiatrists in the United States, we thank you for your openness in reflecting on your mental health in these times. We stand in solidarity with the vulnerability you expressed, which we know many other Black women experience. We share with you the burden of current events, including the disproportionate number of deaths of Black people from COVID-19 and the killings of Black people at the hands of police, especially Black women like Breonna Taylor. Black women have always held a unique place in caring for the Black community. The violence that we absorb and hold in our bodies and our minds often goes unaccounted for, placing our mental health at risk. We endure ongoing racial discrimination across all spheres of society, from workplace microaggressions to relentless health inequities to rampant violence against Black trans women. We watch as our children experience trauma, especially related to gun violence. We feel the weight of justice that is all too often delayed or denied. As psychiatrists, many of us care for Black women in our communities. We bear witness to the pain experienced by Black women. Though it is systemically unrecognized by traditional healthcare systems, our current systems over-pathologize Black women's experience of pain and trauma, rather than affirming and acknowledging our experience as valid. Black women's mental health should be a national, I repeat, a national priority. We stand in solidarity with Black women, Black mothers, and Black girls. We say to women, young and old in our community, you are seen, you are heard, and you are visible. We applaud you, Mrs. Obama, for using your voice in a way that promotes the mental health of Black women in these trying times. We thank you for using your voice as a Black woman to amplify and validate our pain and grief as Black women. Yours sincerely, Black female psychiatrists in the United States. This is a very poignant letter, which was sent to her a couple of months ago. We have yet to get a response from her, but I'm sure she's looking through it. She's a busy lady right now. But this pinpoints what I've been talking about and what this webinar is all about. Black women bear the brunt. We're like sponges. We take in everything that happens to our children, to our family, to our men. We bear the brunt, and it's time for us to recognize the issues that we're dealing with, and also to recognize how to solve some problems that we might have and how to take care of ourselves. So let's get started. Are you ready for our first speaker? Yay, yay. Our first speaker is a phenomenal woman. Her name is Dr. Aderonke Pederson. Dr. Pederson is a psychiatrist and faculty member of the Feinberg School of Medicine at Northwestern University. Dr. Pederson's work focuses on advocating for the mental health and wellness of Black people. Dr. Pederson's research focuses on building interventions to reduce stigma around mental health in the Black community. And there is stigma, folks, in the Black community about mental health. She is particularly interested in the intersection of race, religion, stigma, and migration. And she's funded by the National Institute of Health, maintains a clinic that serves particularly Black women. She's an author, and she's published peer-reviewed articles as well as a seminal book with the Oxford University Press. She has been featured on NPR, The Washington Post, and the Chicago Tribune for her work in highlighting and advocating for health and wellness in the Black community, particularly Black women. That is why she is here today, ladies and gentlemen. Dr. Aderonke Pederson, take it away.
Hi, everyone. It is such a pleasure to be here in this space, to share this space with you. As I was introduced, my name is Aderonke Pederson. I'm a physician, I'm a psychiatrist at Northwestern University, and I just cannot say how much of a pleasure and how grateful I am to be here in this space, to share this space with my sisters. And, you know, I almost want to do a mic drop for Micah's introduction in terms of just introducing this entire event, just in terms of talking about things like stigma and how important it is for us to talk about these things, for us to see people who we highly respect and regard talk about these things. And I want to start with talking about stigma, as Micah's introduced that word and that topic, because stigma is something that, you know, I study, and stigma is something that is very prominent within the Black community. I think it's prominent across the board, but I want to specifically talk about stigma as it relates to us in the Black community. Some of my areas of research, like Micah introduced me, include, you know, talking about stigma related to mental health, stigma in the Black community, but also stigma related to race, religion, and migration, meaning I work with African immigrants as well. So what is stigma? We use that word quite a bit. What does it mean? Essentially, stigma is having negative attitudes and beliefs about mental illness. And I like, you know, I think it's important for us to parse out then, you know, how does that sort of play out? So stigma can be towards ourselves. So we might have feelings, you know, negative feelings and beliefs about ourselves because we have depression or anxiety. Stigma can also be things that we feel about what other people think of us, and that's sort of sometimes called like public stigma. And stigma can be how we feel about other people, and I think that's something that, you know, we do need to talk about and do need to really allow ourselves to explore this idea of how do you relate to other people who might share with you the struggles that they might be having, who might share with you that they're depressed, or they saw a therapist, or they saw a psychiatrist. What are some of the ways in which we respond that make it hard as a community for us to talk about these things? And so when we're talking about stigma, I think it's really important for us to think and reflect. You know, how do I contribute to stigma and how do I experience stigma? And really trying to look at it from both sides. The other thing I really think it's important for us to talk about is, you know, this idea of sharing our own lived experiences with others. Because I think many times we, you know, have our sort of secret ways in which we deal with our mental health, but we don't talk about it publicly. So one of the things we found in research is that one way to reduce stigma is to actually share about our experiences of stigma, to share about our experiences of mental illness. So for example, I'll share some of my experiences when it comes to mental illness and mental health in general. You know, I lost both of my parents by the time I was 17 years old. I was an orphan by the time I was 17 years old. So I went to college without a support system, without a support network. And in part that was exacerbated by by my status at that time as an international student. So I didn't fall within any particular brackets within the system. And my process of getting through that time involved just this idea that, you know what, I'm a strong Black woman. And I think we hear that a lot. You're a strong Black woman, you can get through it, you just, you know, survive. And I think many of us kind of live in that space of we just need to survive another day. But really what I want us to talk about is the importance of thriving, not just surviving. And what does thriving look like? Can we thrive by ignoring our mental health? Can we thrive by just focusing on our physical health? And I'll talk about how I think those things are one in the same, that they're not really two separate things, but they're really one thing. And that idea of being a strong woman, a strong Black woman, I think it's really important that we understand that strength is not just about what you can do, but strength is also about appreciating our limitations, appreciating our weaknesses, appreciating those things, you know, that might set us back if we ignore them. So part of being strong is actually acknowledging that we're human and that we're weak, and that it's okay to admit that we're overwhelmed, that we're stressed out, that we're having trouble sleeping, that we're anxious. It's okay for us to admit those things. And in many ways, that is part of strength. It's very difficult. It's very hard to ask for help. It's very hard to ask for support. But part of our strength is being able to identify those things that we're struggling with and to identify the places and spaces in which we can get help. And that brings me to the next thing I want to make sure we talk about, which is a toolbox. I love that we're doing a raffle to give away what we're calling like a stress, package, a stress gift bag. And so I want to use that to talk about what we call a toolbox, a coping toolbox, that we can use to kind of get through things. And I think for a lot of people, there's this feeling that your toolbox can only be one thing, or your toolbox, which is how you deal with stress or anxiety or depression, can only be, for example, my faith or my religion. So when I look at stigma and when I work with folks in the community about stigma, one thing that always comes up is this idea that I have to pick and choose. I have to pick my pastor or my priest or my imam. I have to pick that, or I go to the doctor. And I think it's really important for us to understand that that toolbox can include both things. So it's not about throwing out one or the other. It's okay. I think it's so important, that we embrace those things that are helpful to us. So whether that's religion or faith or spirituality, that can be in our toolbox. But I also think it's important that we don't ignore those other spaces like seeing a therapist, seeing a counselor, spaces like getting medication. And these are taboo topics sometimes, but I'm so glad that we're having these conversations. So in your toolbox, you could have your spiritual leader in your toolbox, but you could also have your physician, your psychiatrist, your therapist in your toolbox. And the goal is that as you go along, that you're learning more and more and more about yourself, to the point where you fortify that toolbox in such a way that it fortifies you. I'm really grateful for those women who've come out, Black women like Michelle Obama, to talk about mental health. I'm also grateful that I've seen a couple talks by Kamala Harris about mental health. And one of the things she said a couple times now, which I'm so excited about, is that, our health is not just from our neck down. Our health is also from our neck up. And so she's talking about mental health, and she's talked explicitly about mental health. And I think that's so important, especially because of some of the things Micah brought up earlier. The fact that, as a community, as Black women, we take on so many burdens, and we're asked to sort of, kind of pretend and go along as if these burdens are not being absorbed into our bodies in a way that then put us at risk, not just for depression and anxiety, but remember that these things also put us at risk for other physical illnesses like cardiac issues, like diabetes, that our body is a holistic thing. And it's important for us to think about our bodies holistically, that our mental health affects our physical health affects our mental health, and that they're in many ways one and the same. It's sort of like a construct, in our world today, that we talk about them differently. Another big body organization that has talked about mental health is the World Health Organization. One of the things the World Health Organization came out and said, many years ago, is that there is no health without mental health. And when we're talking about things like depression and anxiety, what are the symptoms of depression? Sometimes we might notice our sleep changes. Sometimes we might notice our appetite changes, our motivation to do things changes, our relationships change. We're not as excited about being around people. We feel more lonely, even though there are a lot of people around us. And it's really important for us not to shy away from the idea of getting help in those times. Because one of the things we see in the Black community, whether it's African Americans or African immigrants, is that we delay seeking treatment, and how important it is for us to get support and help early on, because the more we delay it, the harder it is to sort of get back on track. So the main thing I want to leave everyone with today is the importance, the vital importance of taking care of our mental health, understanding what's in our toolbox. And our toolbox, like I said, can be a combination of things that are unique to us, the things that energize us, the things that rejuvenate us. And, from the psychiatrist, the therapist, like we talked about, to the religious leader, to the priest, the pastor, like we talked about, But even journaling, even exercising, all of these things are part of our toolbox. And we don't want stigma of mental health to become a barrier to us thriving. Because at the end of the day, the point of mental health care is that we don't just survive, the struggles and the stresses that we're experiencing constantly, but that we thrive, that despite all of these things that are going on in our society, that we find a way to really guard our mind and allow ourselves to really thrive. So thank you so much for having me. Thank you so much for having us talk to you today about mental health. It's been a pleasure, and I really appreciate this time.
Dr. Pederson, thank you so very much. That was phenomenal. I love how she brought up the fact that stress and things can lead to so many physical illnesses, and we need to be aware of that. Also the stigma, and to have a toolbox. I hope that we take away a lot of things from today's event and know that mental health should not be a taboo topic. Okay, let's go on to our next panelist. Dr. Crystal T. Clark is a board-certified adult psychiatrist and an associate professor of psychiatry and behavioral health sciences, and a secondary academic appointment in obstetrics and gynecology. She specializes in mood and anxiety disorders. She's internationally recognized for expertise in the treatment of women's mental health broadly across the lifespan. Dr. Clark is a researcher who aims to optimize mental health treatment for all. Her research has been funded by the National Institutes of Health and the PHRMA Pharma Foundation. As someone committed to educating the next generation of psychiatrists, she serves as a director of the Advanced Training Fellowship, Women's and Perinatal Mental Health at Northwestern, and as the Associate Program Director for General Adult Psychiatry Residency Training. She is the president of the Board of Marseille of North America, an organization committed to advancing mental health care for perinatal women and their families. She is also a member of the Board of Directors for Resilience, a nonprofit organization dedicated to providing resources for sexual assault survivors. Dr. Clark received her Bachelor of Arts in Psychology from Northwestern University and her Master's of Science and Doctor of Medicine from the University of Louisville. She completed her psychiatry training at Johns Hopkins in Baltimore, Maryland. Dr. Clark has been a contributor for several media outlets, including National Public Radio, New York Times, Washington Post, Forbes, Atlantic, ABC7, CBS Chicago, and Chicago Tonight, and hopefully soon WGN. Dr. Clark.
Well, good morning, everyone, and thank you so much for having me. And thank you, Michael, for that wonderful introduction. It is a pleasure to talk about something that's passionate and dear to my heart, and that being women's mental health to a group of women. So it's a pleasure to be here. And thanks to Dr. Pederson for leading us in that fabulous talk and really speaking about stigma and thriving. I'm going to speak somewhat about the same topics as I'm sure our next speaker will too. As it relates to reproductive psychiatry, that is what I am and one of my many areas of expertise. What does reproductive psychiatry mean? Well, reproductive psychiatry, I like to say, is where the hormones meet the mood. When your period started at 11, 12, or 13, noticing how sensitive you might become when your period was coming. That is a time in which the hormones are meeting the mood. But the hormones meet the mood throughout the lifespan of women, through pregnancy and postpartum, through infertility treatments when we're trying to get pregnant for those who don't get pregnant naturally. It also happens when we're trying to prevent pregnancy and we're taking oral contraceptives. And for the wise counsel in this virtual space, I'm sure they can speak a lot about how it changes when you reach perimenopause and postmenopause. And through all of those stages of life, I'm working with women, not only to empower them, to educate them, to advocate for them, but to help them restore their mental well-being. So today I want to talk to you about a few things, highlighting some of the stigma and disparities, but mainly addressing the reproductive lifespan and particularly the motherhood journey and how Black women are affected during that time as it relates to my second point being about postpartum depression and anxiety. During the motherhood journey, that is the most common onset of illness, mental illness, such as postpartum depression and anxiety. And then tell you more about when to seek help and leave you with some resources. So let's talk about the maternal journey, the motherhood journey. particularly as it relates to Black women. Well, in this COVID pandemic, if you haven't heard enough about all the things and the disparities happening to Black women, I am sure you are hearing more about maternal mortality. The fact that that women, Black women in particular, are 3 times more likely to die from childbirth than their white counterparts. And that Black babies are also 3 times more likely to die than their white counterparts, 2 to 3 times. And it's not just a national US issue, but this is a global issue that we are not addressing enough. That women are dying from complications to birth, that being postpartum hemorrhage or blood clots or hypertension. But even more so, we're not talking about another thing that we are dying from, and that's maternal suicide. It being the 3rd leading cause of death in some areas, and definitely here in the United States. So what does that mean for the Black woman? Well, too often, as Dr. Pederson spoke about, we're not sharing our stories. Micah also brought attention to this. We're suffering in silence. We don't know enough about what it means to have mental illness and when to seek help. So let me tell you a little bit more about postpartum depression, postpartum anxiety, and other mental illnesses that we Black women are not immune to, that we also experience, and it can also take our lives. So postpartum depression, many of you who are listening in, I'm sure, have had children. I know many of your friends who have had children. And I wonder if you take a moment right now and just think about how you felt when you had a child, or how you observed your friend or cousin or family member, what their experience was like. Do you remember seeing postpartum blues? Do you remember them complaining about any challenges they were having? What was your experience like? Just take a moment and think about it. Well, I will tell you that 1 in 7 and as much as 1 in 5 women experience postpartum depression or anxiety. So if you just know 5 people, one of them is likely, who has had a child, one of them is likely to have experienced postpartum depression or anxiety. And as a result, have probably needed to get help, may not have sought it, but have suffered with what that pain means. So postpartum depression, let's talk a little bit about that. Postpartum depression, the symptoms typically, as Dr. Pederson was sharing, it's like depression at any other time in life. It's the onset of sadness for no reason often, or in the context of another trigger. The lack of interest in doing things, maybe attending to the baby is not of interest, maybe seeing friends and family. A change in sleep, and I love this one because I have so many patients, particularly my women of color and my Black women who come in and they say, well, of course I'm not sleeping, I have a baby. And yes, sleep deprivation is common with having a child, but too often we're ignoring the science that no, when the baby sleeps though, you can't sleep either. When the baby is sleeping through the night, you're still not quite sleeping well, even though, you're trying really hard. You're laying in the bed, you're staring at the ceiling. What about the fatigue? My patients always tell me that too. They're like, oh, no, it's because I have children. Of course I'm tired. But the fatigue of postpartum depression is much more extreme than what we experience from having to get up, feed the baby, attend to the child, just all of the rigors of our daily lives. In worst case scenarios, we know that women will also experience decrease in self-worth, hopelessness, guilt, and often, too often, I should say, feelings that they don't even want to live anymore. And what about anxiety? Anxiety is similar, where you see that women experience more irritability. They're much more worried, excessively worried about things that they shouldn't be worried about, or that others, I would say, would not worry about as much. They might feel tension in their neck, their head, their entire body, restlessness that just won't go away. And these symptoms are more common, more days than not. And that's what makes them pathological. That is what requires addressing. So when to seek help? I tell people seek help whenever you start to feel this way. If it's been more than a couple of days, more than a couple of weeks, it's okay to seek help, because if we have a respiratory infection, guess what? We're calling our doctors like, can I get a Z-Pack? Can I get some help? Are you sure this isn't a pneumonia or something? This has really been bothering me for, several days now. So we should do the same for our mental health. If we are experiencing something that is bothering us and we're not sure what it is and whether it's related to childbirth or being pregnant, we should seek help and say, is this normal? Is what I'm experiencing okay? Should I be getting treatment? And that would help us to recover quicker. Too often Black women are suffering in silence. But more importantly, you should seek help if it's impairing your ability to function. You can't get your work done like you used to. You're unable to get things done in the house, unable to attend to your self-care like you should, just unable to focus like you once did. Those are also times, or critical times, to seek help. So with that said, I want to leave you with some resources. We have, of course, this wonderful panel today. We are all at Northwestern, and you can seek us out. We would love to be of help. But you can also reach out to Therapy for Black Girls, Melanin and Mental Health, and Sister Afia, who is a resource here local in Chicago. When you're seeking out for help, therapy is a great place to start, whether it's with a counselor or psychologist. Just again, going in and saying, hey, I need an evaluation. This is what I'm experiencing. You can process those emotions and work through getting rid of those negative emotions so that you can recover from what you're experiencing. You can also, in moderate to severe cases, seek out a psychiatrist. And maybe you don't know if you're having a moderate to severe case, so just go get the evaluation. If you are having a moderate to severe illness, they might recommend medication. So too often we hate that word, and we as Black women don't want to take medication. But I'm here to dispel some myths. Medication will not be addictive. We're not talking narcotics. You don't need to have benzodiazepines such as Ativan, Xanax. We're talking about medications that restore your mental wellness. You can stop them, and unfortunately, the illness might come back. You can take them and be well and not be addicted to it. And it doesn't change your brain chemistry in any negative way. I have a lot of patients that say, but isn't it gonna change my brain chemistry? Isn't it gonna do something negative to me that I'll never be able to come back from? And I remind them that we don't have a problem taking medication for diabetes, seizure disorders, a heart attack, for a respiratory infection. So why should we treat our mental health any differently? So I just want to dispel a few myths there. Finally, I close with something Dr. Pederson has already so eloquently stated. I guess great minds think alike. I wanted to share with you guys, just highlighting our pride in being strong Black women. Too often we're saying, hey, I'm a strong Black woman. I just gotta fight through it. I gotta push through it. I can do this. And yes, you can do this, but it's okay to do this and seek self-care and get self-care. Too often we pride ourselves in suppressing, repressing, and denying our emotions, denying the pain that we're experiencing, when we really need to seek help so that we can thrive. So yes, we talked about the fact that ignoring that stress can lead to obesity, diabetes, heart attacks, stroke, all the things that bring us, that shorten our lifespan. So I encourage you today to think about strength as being the courage to seek help when you need it, the courage to keep advocating until you get it, and that strength and being a strong Black woman is also fostering physical and mental wellness for the lives that we're bringing into this world. So with that, I close and thank you.
Dr. Clark, phenomenal. Just as Dr. Pederson, we have an amazing, amazing group of panelists. I really appreciate that. Dr. Clark brought a different perspective as far as reproductive and women, and we all go through everything that she's talking about because that's just the natural cycle of the female. So, and being a strong Black woman, yes, being a strong Black woman is being able to ask for help, strong enough and confident enough to know that you need help and support. So thank you, Dr. Clark. Now, let's move on to our next panelist. Our next panelist is Dr. Inger Burnett Ziegler. Dr. Ziegler is a licensed clinical psychologist and an associate professor in the Department of Psychiatry and Behavioral Sciences in the Feinberg School of Medicine at Northwestern University. She's also a mindfulness trainer and certified yoga instructor. She received her undergraduate degree in psychology from Cornell University, her doctorate in clinical psychology from Northwestern University, and completed a postdoctoral fellowship at the University of Michigan. Dr. Burnett-Ziegler has over 15 years of experience providing psychological interventions to help clients with mood and anxiety disorders, stress management, interpersonal relationships, and wellness promotion. Dr. Ziegler is an advocate for eliminating mental illness stigma and assuring that all individuals have access to high-quality, evidence-based mental health care. Her research focuses on examining the factors associated with access and engagement and mental health service utilization, and using this data to develop, test, and implement acceptable and accessible evidence-based interventions in community-based setting. Dr. Burnett-Ziegler's op-eds have been featured in New York Times, Time Magazine, The Hill, and Chicago Tribune. She's an active contributor to the public discourse on mental health via her appearances on CNN, WGN TV, and WTTW Chicago Tonight. She serves on the board of directors for several large healthcare nonprofits, including Heartland Alliance Health and Thresholds. Her forthcoming book, Nobody Knows the Trouble I've Seen, The Emotional Lives of Black Women, will be published March 2021. I'll be getting that book. She is a proud, lifelong Chicagoan. Ladies, please welcome Dr. Inger Burnett-Ziegler.
Thank you, Micah, for that wonderful introduction. Thank you to the Links for organizing this important conversation and inviting me to be a part of it. It's such an honor and a pleasure not only to join all of you, but to be on this panel with my colleagues and, more importantly, my friends, Dr. Clark and Dr. Pederson. I want to start just by sharing with you that in my clinical practice, I primarily see Black women between the ages of 20 to 60 years old across the educational and income spectrum. One of the women that I recently saw in my practice came to me after her husband unexpectedly left after over 30 years of marriage, and she was telling me she hasn't felt the same since. Not only is she struggling with feeling lonely, she's worried about COVID and doesn't feel that her job is providing her with a safe environment to go to work. She's worried about everything that's going on in the world right now, and these worries are keeping her up at night. And her anxiety is becoming debilitating, such that her mind is racing. She's keyed up and on edge, just as Dr. Pederson and Dr. Clark described as the symptoms of anxiety. She's distant from her family, and she doesn't feel like anyone in her family understands what she's going through or that she can talk with them. And she's angry about it. She's angry about her job, she's angry about her marriage, and she's angry that she's alone. Another person that I recently saw in my clinical practice is a 38-year-old single mom. She's in and out of work. Her father left home when she's a teenager, and since that time, she's felt rejected and kind of on the edge of her family and on the edge of relationships. And she comes into therapy because she finds herself chronically in one bad relationship after the other. She's trying to figure out how to break that cycle and to ultimately find herself in a healthy relationship. And then finally, another woman that I saw recently came in after her sister was violently killed by her partner. She's felt traumatized since that time, which was about over a year ago. She was raised by her grandmother. Neither one of her parents were around to help in her caregiving. And she's that woman Dr. Clark and Dr. Pederson talked about, well, all of us are, but this one in particular, that strong Black woman that put herself through college, put herself through graduate school. She's the one that takes care of everyone in her family, the one that they're always going to and asking for help. And she comes to me because she's anxious about being perfect, about being there for everyone, about shouldering that burden of being the strong Black woman. These are some of the common reasons that people come to therapy: relationship issues, health issues, past trauma, family problems. And these issues are getting in the way of them being able to function day to day, to get by and be productive at work, to be present at home with either a partner or children, or to have strong, healthy relationships with family. We've talked about the stigma of mental health, particularly in the Black community. And, you know, when you think about that stigma, it can seem that at times that mental health is other people's problem. But we know that about 1 in 5 people will have a mental health problem at some time in the past 12 months, in the past year. And almost 50% will struggle with a mental health issue at some point in their lifetime. Doctors Clark and Pederson have talked about some of the symptoms of the most common mental health challenges, like depression and anxiety. Depression with people feeling sad, down, hopeless, worthless, low energy, even thinking about death or dying. People who are anxious, worrying all the time. Anxiety is something I certainly can relate to. And you know, it wasn't really until I was in grad school that I realized that sense of panic and worry was anxiety, and that there was actually help for that you don't have to feel that way. That's something I see Black women talking about all the time, that need to be on, that need to be perfect, that need to show up. And the desire or belief that you have to manage everything and get everything done can lead to folks feeling anxious, racing thoughts, staying up at night, tightness in the tummy. And we know that women are more vulnerable to both depression and anxiety than men are. And stress plays a key role in that vulnerability. The American Psychological Association, the APA, indicated that the top stressors for people are money, work, the economy, family, relationships, personal health, housing, job stability, family health, and personal safety. We know that Black women have the added stressors of racism, more economic and employment challenges, and a greater or disproportionate vulnerability to trauma. That trauma including childhood trauma, physical, sexual abuse or neglect, intimate partner violence, or what we formerly called domestic violence, or exposure to community violence, such as gun violence. And this year, not only to add on to our typical stressors, combined with the stressors that Black women face, we have the stress of COVID. More anxiety related to health, worries about contracting COVID, more Black people and Black women serving as essential workers, placing themselves at higher risk for exposure. More worries about job and housing security. Many folks not being able to work from home, and even those who can work from home, struggling to juggle working from home with also being fully available for virtual learning for their children. And as has been mentioned today, these stressors not only increase the likelihood of developing mental health challenges like depression or anxiety, but they also play a role in the physical body, leading to, as has been mentioned, obesity, diabetes, hypertension, cardiovascular outcomes, and the maternal outcomes that Dr. Clark mentioned: preterm birth, low birth weight, and miscarriage, which a lot of news attention has been given around the disproportionate rates among Black women. Not only does it contribute to these negative health outcomes, but these stressors actually, in fact, lower the life expectancy for Black women, where Black women have a life expectancy that's 3 years shorter than that of white women. We're managing us, we, the collective us, and how do we do it? By being strong. We all know the strong Black women. We probably are the strong Black women. Providers, caretakers, people that maybe in the past have suppressed our emotion. We don't allow ourselves to be vulnerable, although maybe after today, as Dr. Pederson described, the power in showing or talking about our struggles. Maybe we'll shift a little bit from that. We're resilient. We are people that bounce back, and we're proud of how we can bounce back. We kind of puff our chest out and say, yes, I can handle it, and we can, right? But that handling more than what is well for us, has consequences. And we know that strong Black women, one of the key characteristics of the strong Black woman is being firm in our faith. And that faith in God certainly has its mental health benefits, right? There's a substantial amount of research that shows that people who are more spiritual, people who pray more often, people who go to church more often have better mental health outcomes. But as Dr. Pederson mentioned, sometimes that faith in God, sometimes the strong Black woman, the belief that we have to be strong, can interfere with us getting the help that we need. We believe that because we have our faith in God, we shouldn't need mental health treatment. Because we're strong, we shouldn't feel the uncomfortable feelings of depression and anxiety, and in turn need mental health treatment. And as a psychologist, those should statements, I work with the folks that I see in my clinical practice to point those out, to point out those negative judgments, to point out those should statements that put us down, that make us feel bad, and interfere with us getting the help and the resources that we need. In addition, other barriers to mental health treatment can be cost, the availability of providers in our neighborhood, particularly if you're looking for a Black provider, location, childcare, time, you name it. If you're unsure about getting mental health treatment, we can find all the barriers in the world. And then stigma, or those negative attitudes and beliefs. More specifically, some of the things I hear people say is, I just don't need it. As a researcher that works in communities to help people to identify their own mental health need, to identify the signs that maybe you need some extra level of help. And I use screening tools, right? To say, okay, these are the signs and symptoms of depression. These are an indicator that maybe you need extra help. And even people that screen high will say, I don't need it, I'm fine. The problem will get better on its own, it'll go away. I can manage it. Therapy is not going to be effective. What are they going to do with my information? Right? Worried about the shame, the stigma, the judgment, not only from family, but from the providers themselves. So I so appreciate the tools that have been offered today. I'm going to borrow that toolkit that Dr. Pederson talked about and use that in my conversations with folks. When people come to see me in therapy, I first congratulate them for just having made it there, right? For taking the time, for carving out this space for just themselves. Because we know that as Black women, we often do everything for everybody else and sacrifice ourselves. So if nothing else, when people come to therapy, they've saved an hour to think about themselves, to focus on themselves. And I try and hold space for them without judgment, with compassion and care. And then we start the process of exploring the root of their suffering, that depression or that anxiety. Maybe it's from a trauma, past or recent. Maybe it's from this idea of, I often hear kind of, what am I doing with my life right now? Seeking for a sense of purpose. Maybe it's feeling lonely, that nobody else understands what you're going through. Whatever it is, we work together to explore the root of that pain. And then as a therapist, I work with people to help untangle those unhealthy thoughts, those woulda, shoulda, couldas, the put downs, the behaviors that keep them stuck in a space of not thriving, as Dr. Pederson mentioned. So often we don't even realize how what I call in therapy the negative self-talk. Right? And I point out, sometimes we are more kind and compassionate in our conversations with our friends and loved ones than in the ways that we talk to ourselves. And so one of my asks for you today is to start to pay attention to how you talk to yourself. Bring awareness to the ways that you might be able to offer yourself loving kindness, gratitude, forgiveness, and let go of those negative thoughts that can contribute to the suffering. In therapy, the first step is awareness, and the conversations that we're having today are a critical part of that. A critical part of developing awareness about how you're feeling on a day-to-day basis. Developing awareness about how those emotions not only impact your mind, but your body. Developing awareness about what's keeping you stuck and maybe where you can get help. What are the available tools for help? Maybe it's your family, maybe it's therapy, maybe it's a physician, what have you. And then using the help that's available to you. I'm so honored to be here today. I'm so grateful for the links, and I'm so grateful, that we have created the space for this important conversation. Thank you so much.
Dr. Ziegler, thank you so much. Thank you all to our panelists. If you heard what she said, that Black women have a lower life expectancy, 3 years lower than whites, you need to make a change. There's a common thread going through all of this that you heard from these ladies, these fabulous, distinguished, and well-educated ladies. Strong Black women. We're all strong Black women, but there is a power in showing your struggles. There is a power in reaching out for help to continue. We know we're strong. Our mothers were strong. Their mothers were stronger. And you go back and go back. But we have to maintain that strength. And in order to maintain that strength, especially now during COVID, because believe me, there are a lot of challenges out there. And on top of everything else, which I said earlier, COVID is adding a little bit more to our stress. And stress can cause so many other problems that you heard these ladies talk about. And we are resilient, but there's a point where that resilience is going to give out. So you have to keep coating the resilience to make us even more resilient. And as you coding means seeking out help, seeking out support, recognizing, first of all, that you need that help. Because you have to first thing is to recognize that you need that help, to not ignore the symptoms, to understand that there are people who can help you, and forget the stigma. And we're going to talk a little bit more about how do we ignore the stigma that has been in our society for so many years? I don't know about you. I learned a whole lot today. These ladies were phenomenal. We broached a subject that is not often talked about, and it was a great conversation. And I thank each and every one of you today. I'd like to thank, first of all, Dr. Crystal Clark. I'd like to thank Dr. Inger Burnett-Ziegler, and also Dr. Aderonke Pederson. Thank you all so very, very much for being here today. And I appreciate your candor. I appreciate you taking time to talk to us, because even though we're virtual, we're still taking time to do this. But this is a very important subject, and I hope that you all enjoyed it.